Allô, Nissan? Hey, grosse tempête, hein?
Hey, Karine, oui, je sais, les vilains bonhommes de neige sont de retour.
Mais avec le Nissan Rogue à traction intégrale, c'est pas stressant.
Exact, il est conçu et testé pour nos hivers. Oh, Karine, il y a un bonhomme dans le Rogue.
Ah, c'est correct. J'ai allumé les sièges chauffants.
Ah, bien joué, Karine. Maîtrisez toutes les conditions. Louez le Rogue S 2026 à partir de 0,4 jusqu'à 36 mois, incluant une réduction fidélité de 0,5 pour les clients Nissan admissibles. Jusqu'au 2 mars, sur approbation de crédit, les conditions s'appliquent. Détails chez Nissan.
Well, could a balloon help you lose weight? You know, a couple of weeks ago on this program, we were discussing the rising crisis of obesity in Canada. And it's a problem that really can't be ignored any longer. Now, there may be a solution for those who suffer, and it comes in the form of a balloon and a procedure that requires no surgery or even anesthesia, but a balloon which inflates in your stomach to make you feel full. Let's take a closer look. We're joined by Dr. Lamise Almutlaq, a bariatric surgeon performing the gastric balloon procedure. Dr. Almutlaq, welcome to the show.
Thank you. Thank you so much for having me.
So tell me about this balloon and how you get it into the stomach here. I would imagine you got to swallow it somehow, but that seems harder than harder to do than I can say it. So why don't you tell us about it?
Great. So as you said, I just reiterate here, it is a balloon that is non-invasive, requiring no surgery and no anesthesia, promoting weight loss, and all within a 15 to 20 minutes walk-in procedure. It starts with the patient swallowing a capsule with a glass of water, and this capsule is actually contains a deflated gastric balloon. This is attached to a thin catheter, and once the balloon reaches the stomach, we take an X-ray, we confirm that it's in the correct position, and then we fill it up with a solution, allowing it to become essentially almost the size of a medium-sized grapefruit, and that takes up the space in the stomach, making the patient feel full.
Now, who would qualify for something like this? I mean, you said you walk in, it's 15 minutes, it's done, but I imagine you won't let just anybody do this. Who is someone that you would think should be considering something like this?
Right. So actually, like you said, it's not for everybody that's going to walk in, but we use a measure which is an index called the body mass index. And the body mass index is a measurement to estimate body fat using the height and weight of an individual, which we would calculate. And that would be between a body mass index of 27 to 35 with some medical problems or not, but essentially we start off with that.
And let me ask you this. If a procedure like this works, you know, a grapefruit-sized balloon in the stomach, that would clearly make you eat less. Does that lend credence to the whole notion? Well, we're overeating here. Like, is that at the heart of this for people that are facing obesity issues? Is this just a very simple way to reduce the amount of calories that are being consumed?
Right. So there are multiple ways how this works, but one of the reasons why this balloon works is that it not only takes up about 60%, let's say, of the stomach size, decreasing the amount of consumption, but it also slows down the time that allows the stomach to empty the food. And so it allows patients to feel fuller with smaller amounts of food, but for a longer period throughout the day. And it's important to mention that this is going to be done in combination with the support of a dietitian that will help the patient reintegrate and restart a healthier dietary lifestyle modification that can last. But it also gives them this honeymoon from hunger, essentially, because of this effect. And that's why it helps the patient start, incorporating healthier habits and start exercising, all within feeling comfortable. And that's why it became a game changer, essentially.
We're with Dr. Lamise Almutlaq from Clinique Michel Gagner. We're talking about a gastric balloon procedure to help people dealing with obesity. So let me ask you this, doctor, because, it seems like the human body is designed to not like foreign objects inside of it. So what's special about this balloon so that, the body doesn't feel I need this out of me?
So there are, one of the major changes with this type of balloon is that the balloon actually deflates and sort of passes through naturally through the digestive system at about 4 months after placement. That's one of the reasons why it's great. It's because it passes through without causing any issues for while it's being in the stomach for longer periods of time. But also, it is made from a material called polyurethane, which is 85% lighter than other silicone gastric balloons that can be available on the market. And this makes the balloon gentler on the stomach and a lot more malleable. And so the patients, we do have a higher or essentially greater tolerance of this balloon.
And doctor, what are you seeing right now? Can you give us an example of how this has been a life changer for someone? Maybe a story about someone who came in who, was in very bad shape or not feeling good about life, and how this really helped them.
So on average, we can expect a loss of about 10 to 15% of body weight, within these 4 months, and half of this percentage usually is seen at the first month. So it really kickstarts that journey for patients. For a lot of patients who, especially have been struggling with this yo-yoing of weight regain and weight loss, but who are on the verge of starting medications or other medical problems related to the weight excess, are able to prevent that by losing this percentage of fat and then essentially starting to boost their confidence, increase their energy, and stay motivated to continue, whether it may be that they came off of some of their medications or we prevented them from actually going on medications to treat other medical problems.
Dr. Almutlaq, we have to leave it there. I want to thank you so much for coming on the program.
Thank you very much for having me. Appreciate the opportunity.
Absolutely. That is Dr. Lamise Almutlaq, a bariatric surgeon performing the gastric balloon procedure, works out of the Clinique Michel Gagner.